doctors, OB-GYNs, family practitioners out there. If you have a patient, I want you to remember this, 40% of all females are estrogen dominant. 40%. What does that mean as far as copper is concerned? Copper responds to estrogen. When estrogen levels go up, copper levels go up. That's why you see the mood swings with regard to the monthly cycle in these females, right? Because when copper goes up, it now turns dopamine into norepinephrine. Norepinephrine in the adrenal gland will cause adrenal fatigue, and you'll start to see depression and mood swings. I want you to use that as a base, right? Number 40%. So when you see a female and she comes in and she's telling you she's got these issues and she wants to say start on birth control, one of the first things you really need to do, check that copper level, okay? Call DHA, order the testing for copper, and I would actually check copper and ceruloplasmin because you would need to do a percent-free copper test because percent-free copper can be really damaging even in the presence of what looks like a normal total copper level. So that's a calculation that's done that requires ceruloplasmin, okay? But when you've got a high copper female, the last thing you want to do is to add a copper IUD to the patient. We're dealing with a case literally just 2 days ago when a young lady called in, and it was actually her mother, who stated that when she started the copper IUD, her world turned totally upside down and horrific. Now, she looked like she had a typical normal copper level. But what we oftentimes forget is that the role of a mechanical device, a structural device in the uterus, creates inflammation. Now, somebody who's hypersensitive, in general, when they have a device that creates inflammation implanted in their system, it's like a domino effect. The inflammation doesn't stay local. It can spread throughout the entire body. We've seen it on several occasions. So typically speaking, something like an IUD is not our choice when it comes to contraception. But if it is something you want to go with, first check the copper level, check the ceruloplasmin level, do the calculation, and make sure that there is not an elevated percent-free copper. Because not only can that be a problem now, that can be a problem later on in life with issues like ovarian cysts, fibroids, endometriosis, breast cancer in the family. Doesn't have to be in that person, in the family. So do a little bit of a family history. Find out if the young lady has got any relatives, sisters, cousins, mostly sisters, moms, aunts, grandparents, females, with any of those past conditions. If they do, that's a sign that they're estrogen dominant and copper toxic, or they have a strong tendency toward copper toxicity, and then stay away from the copper IUD. It just wreaks havoc in many a young lady. Copper's devoted to estrogen. They're so close. They're loving one another. The copper is not going to pay attention to any other hormone other than estrogen. When estrogen levels go down, copper will go down. When estrogen levels go up, copper levels go up. It doesn't matter what other hormone you're giving, okay? So you've got to be careful. If it's HRT, once again, check your patients to make sure that they don't have a family history of any of those things we talked about, breast cancer, fibroids, endometriosis. Otherwise, it doesn't matter what other hormone you're going to give. It's not going to cancel out the copper. It is not.